Evelyn Hayes liked the rhythm of the mop. Push, sweep, wring, repeat. It was a simple, predictable cadence. At 36 years old, Evelyn wore faded, oversized blue scrubs that expertly hid the lean, heavily scarred, and athletic build beneath them. Her graying brown hair was tied back in a messy, unassuming bun. To the doctors, nurses, and administrators bustling through the brightly lit, state-of-the-art emergency department of St. Jude's Medical Center, Evelyn was basically invisible. She was just Evie, the quiet, polite custodian who kept her head down, never spoke above a whisper, and always apologized if her cleaning card got in the way. That was exactly how she wanted it. No mortifier, no screaming radios, no the suffocating smell of copper and sand. Just the soothing hum of civilian fluorescent lights. "Watch the shoes, Evie, please," a sharp, exasperated voice snapped. Evelyn paused, pulling her mop back. Dr. Vance Sterling, the hospital's aggressively handsome and notoriously arrogant chief of trauma, stood glaring at her. He was flanked by 3 nervous surgical residents who hung on his every word. Sterling wore a tailored suit beneath his pristine white coat, his posture radiating unearned battlefield bravado. "I'm so sorry, Dr. Sterling," Evelyn murmured, keeping her eyes fixed firmly on the polished linoleum. "I'll move the cart." "Just be mindful. Some of us are dealing with life-and-death situations today," Sterling huffed, adjusting his cuffs. He turned back to his residence, instantly dismissing her existence. "As I was saying, the key to a standard thoracotomy is absolute, unquestioned control of the room. Panic is for amateurs." Evelyn retreated to the corner, resting her hands on the handle of her mop. She watched Sterling walk away. Her eyes, contrary to her submissive posture, were sharp and calculating. Out of pure, ingrained habit, she passively assessed the entire ER. She noted the heavy fire doors to the north, the exact distance to the primary crash carts, and the structural load-bearing pillars. It was a compulsion she couldn't turn off, no matter how hard she tried. Then, the ambient noise of the hospital was shattered. It wasn't the standard rising wail of a city ambulance siren. It was the guttural, terrifying roar of modified V8 engines pushed to the absolute point of destruction, followed by the deafening screech of heavy tires on asphalt. Before anyone could even turn toward the ambulance bay, the massive automatic glass doors of the ER didn't just open, they were violently smashed off their tracks. A shattered, smoking black SUV had literally rammed over the curb, coming to a halt halfway inside the hospital entrance. The pristine waiting room erupted into absolute pandemonium. Civilians screamed and scattered as the vehicle's doors kicked open. 4 men poured out. They weren't paramedics. They were wearing torn, blood-soaked tactical gear and shattered body armor. They moved with the frantic, adrenaline-fueled aggression of men still fighting a war. "We need a trauma team right now. Move, move," one of the men roared, his voice echoing off the tile. He swept his weapon to the side, forcefully shoving a stunned security guard out of the way. Between them, they carried a makeshift stretcher constructed from a ripped Kevlar vest and steel poles. On it lay a man in his late 50s, his expensive suit shredded and soaked in a terrifying volume of bright, arterial blood. Dr. Sterling, momentarily frozen by the sheer violence of the arrival, finally snapped out of his shock. "I am the chief of trauma. Stand down and let my people through," he yelled, rushing forward with a team of bewildered nurses. From her corner, 30 feet away, Evelyn hadn't moved, but her posture had entirely changed. The slouch was gone. Her spine was rigidly straight, her eyes locked onto the patient with hyper-focused intensity. While Sterling was busy yelling at the armed men to drop their gear, Evelyn was silently diagnosing the dying man from across the room. Paradoxical chest movement, left side, bright red spurts from the upper thoracic cavity, tracheal deviation. He doesn't just have a puncture, his subclavian artery is shredded and his lung has collapsed. "Get him on bed 1, Sterling barked, his voice pitching up an octave as the reality of the gore hit him. "Start a massive transfusion protocol. Pump him full of O-negative and prep a central line." Evelyn's eyes narrowed. Sterling was falling back on textbook civilian trauma rules, but this wasn't a car crash. The entry wounds she could see were from high-velocity shrapnel. If Sterling pumped the man full of fluids before securing the airway and packing the junctional bleed, the pressure would burst the remaining vascular tissue. He was going to drown the patient from the inside out in less than 2 minutes. The heart monitor, quickly hooked up by a trembling nurse, began to emit a rapid, terrifying, high-pitched alarm. The patient's blood pressure was free-falling. Sterling stared at the massive pool of blood forming on the pristine bed, his hands hovering over the patient. His mouth opened, but no orders came out. The arrogant chief of trauma had completely frozen. In the corner of the room, Evelyn slowly released the handle of her mop. It fell, clattering loudly against the floor. The quiet hospital custodian was gone, and the woman who replaced her was about to go to work. The sound of the mop handle clattering onto the linoleum was like a starting pistol in Evelyn's mind. 30 feet away, the ER was a tableau of panicked incompetence. Dr. Vance Sterling stood paralyzed over the VIP patient, whose graying face was twisted in silent agony as his lungs filled with blood. The heart monitor's rhythm was now a chaotic, fluttering scream. "Dr. Sterling!" a surgical resident yelled, her voice cracking. "He's throwing PVCs! Blood pressure is 60 over palpable and dropping! We're losing him!" Sterling blinked rapidly, sweat beading on his forehead. I need... He looked around wildly, his textbook knowledge deserting him in the face of raw, kinetic trauma. "Prep for an emergency thoracotomy. I need to open him up." Evelyn closed the distance to the trauma bay in seconds. She didn't walk, she advanced. Her gait was smooth, low, and terrifyingly purposeful. She didn't ask for permission. She brushed past a stunned security guard, her shoulder striking him with controlled hydraulic force, sending him stumbling aside. She stepped into the sterile field of Trauma Bay 1. "Stop," Evelyn said. Her voice wasn't loud, but it possessed a resonant, metallic authority that seemed to cut through the alarms and screams. Everyone in the bay froze, including the 4 armed tactical guards. They looked at the unassuming woman in oversized blue scrubs and faded sneakers who had just invaded their space. Sterling looked up, his face flushing crimson as he recognized the custodian. "What are you doing? Get out of here! You are contaminating a sterile field!" Evelyn ignored him. Her eyes were locked on the patient's neck and chest. She saw the distended jugular veins, the slight trachea shift to the right. "If you crack his chest now, the drop in intrathoracic pressure will kill him instantly," Evelyn said, her tone cold, precise, and devoid of emotion. She was no longer Evie, she was calculating variables. "He has a massive left-sided tension pneumothorax, complicating a proximal subclavian bleed. He needs decompression before you do anything else." For a second, there was total silence. The surgical residents looked from Evelyn to Sterling, shock radiating from them. The janitor was speaking advanced trauma dialect. Sterling's arrogance returned, fueling his panic. He didn't process the diagnosis, he only processed the insubordination. He stepped toward Evelyn, looming over her. "How dare you?" he hissed, his voice trembling with rage. "You are a custodian. You sweep floors. You do not talk to me. You do not offer medical opinions. Nurses, get this crazy woman out of my ER before I have her arrested." He turned back to the patient, grabbing a scalpel from the tray. "I am the chief of trauma. I am opening this chest." Evelyn looked at the tactical leader, the man who had yelled about the convoy earlier. He was watching her, his hand hovering over his sidearm, assessing her unexpected calm. Evelyn spoke to him, not Sterling. "His lung has collapsed. Air is trapping in his chest cavity, crushing his heart. He's about to flatline. In 10 seconds, Dr. Sterling's scalpel will be irrelevant. If you want your principal to live, you need to let me work." The tactical leader looked into Evelyn's eyes. He didn't see a custodian. He saw a cold, hard competence that he recognized from the darkest corners of the world. The heart monitor issued a single, solid, terrifying flatline tone. "He's a systole!" the resident screamed. Sterling froze again, the scalpel hovering above the patient's skin. "Let her do it," the tactical leader ordered, stepping forward and placing his massive gloved hand over Sterling's hand, physically stopping the incision. He looked at Evelyn. "Do it now." Evelyn didn't wait. She reached onto the sterile tray and grabbed a large-bore 14-gauge angiocath needle, ignoring Sterling's sputtering gasp of outrage. She stepped up to the patient's left side, her movements a blur of practiced precision. She didn't use an alcohol swab. She didn't look for landmarks. She felt the structure. She placed 2 fingers on the patient's collarbone, identifying the second intercostal space at the mid-clavicular line. With zero hesitation, Evelyn drove the massive needle straight into the dying man's chest. There was a loud, sickening hiss of escaping air, like a tire being punctured. The sound was immediately followed by a spray of trapped, frothy blood that coated the front of Evelyn's blue scrubs. She held the catheter in place, her expression unchanging, as the alarms on the monitor suddenly broke. The solid tone shattered back into a rapid, chaotic, but unmistakably beating rhythm. Evelyn had just brought a dead man back to life in the middle of a civilian ER. Sterling was white as a sheet, staring at the custodian and the spray of blood on her chest. Evelyn didn't look at him. She didn't look at the stunned nurses. She kept her hand on the catheter, holding the patient's life in place. She said to the tactical leader softly, "He's back." Then she turned her eyes to the paralyzed chief of trauma. "Now, Dr. Sterling, while he's stable, are you going to keep screaming at me, or are we going to fix this subclavian bleed?" The hiss of trapped air escaping the patient's chest was the loudest sound in Trauma Bay 1. The rhythmic electronic chirp of the heart monitor returning to a viable sinus tachycardia felt like a thunderclap. For 3 agonizing seconds, nobody moved. The nurses were frozen. The surgical residents stared, mouths agape, at the middle-aged custodian whose faded blue scrubs were now heavily speckled with the patient's arterial blood. Dr. Vance Sterling's shock finally evaporated, instantly replaced by a blinding, career-protecting rage. The humiliation of being corrected and saved by a janitor in front of his staff and armed men was too much for his fragile ego to process. "Get your hands off my patient!" Sterling shrieked, his voice cracking. He lunged forward, trying to physically grab Evelyn's wrist to pull her away from the needle she had just plunged into the man's chest. "Security, I want this lunatic in handcuffs. She's fired. She's going to federal prison." Evelyn didn't even flinch. As Sterling's hand shot toward her, she simply shifted her weight and drove her left elbow upward, catching the chief of trauma squarely in the forearm. It wasn't a strike meant to injure, but a perfectly executed, rock-hard block that sent a jolt of localized pain up Sterling's arm. He stumbled back, nursing his wrist, his eyes wide with disbelief. "Do not touch me while I have a needle in a patient's pleural space," Evelyn stated. Her voice was no longer the soft, apologetic murmur of Evie the custodian. It was a low, resonant baritone of absolute command. It was the voice of a woman who was used to being obeyed while rockets fell around her. "Arrest her!" Sterling yelled to the stunned hospital security guard lingering near the shattered glass doors. The guard took half a step forward, looking completely lost. Before the guard could intervene, the massive tactical leader who had carried the stretcher stepped squarely between Evelyn and Sterling. The operator didn't draw a weapon, but he didn't need to. He simply crossed his arms, forming a human wall of Kevlar and muscle. "The lady stays," the operator growled, his eyes fixed on Sterling. "You step back, Doc." "You can't do this," Sterling sputtered, his face purple. "You're conflicting authority. This is a sterile surgical environment." "This is a combat zone," Evelyn corrected, without looking up, "and right now you are a liability." Suddenly, the monitor alarms flared again. The patient convulsed weakly. A fresh, horrifying surge of bright red blood welled up from the jagged shrapnel wound near his collarbone, instantly overflowing the meager gauze pads the nurses had dropped on it earlier. "His pressure is tanking again," a resident yelled, staring at the screen in panic. 70/40 and dropping. The subclavian is completely severed. Sterling tried to push past the operator. "We need him in the OR. Get the transport team. We have to crack his chest up there." "He doesn't have time for the elevator, doctor. He's bleeding out in 90 seconds. Evelyn turned her gaze to the terrified surgical residents. The custodian facade was completely gone. She was a commanding officer looking at raw recruits. "You," she pointed a bloody finger at the tallest resident, "grab the high-volume suction and get in here. Don't think, just clear the field." She snapped her fingers at a trembling triage nurse. "I need hemostatic agents. Combat gauze, Celox, Quick Clot, whatever you keep in this civilian candy store, I need all of it, now. If you don't have it, bring me standard Curlix and a trauma dressing." "Don't listen to her," Sterling screamed from behind the tactical operator. "I am countermanding that order. I will pull your medical licenses." The nurse hesitated, paralyzed by the conflicting authority. Evelyn slammed her bloody hand flat against the stainless steel tray, the sharp crack making everyone in the room jump. "Look at the monitor," Evelyn roared, her voice finally reaching full volume, vibrating with terrifying authority. "He is dying right now. You can worry about your licenses tomorrow, or you can hand me the goddamn gauze and help me save a life." The sheer, overwhelming force of her command shattered the nurse's paralysis. She scrambled to the supply cart, ripping open 3 packages of hemostatic combat gauze and dropping them onto the tray. Evelyn grabbed the gauze. She didn't reach for delicate forceps or a retractor. There was no time for civilian finesse. This required brutal, tactical damage control. "Hold him down," Evelyn ordered the tactical operators. "This is going to hurt." She stepped directly into the pool of blood on the floor, bracing her feet. With her bare, bloody hands, Evelyn Hayes plunged the hemostatic gauze directly into the deep, jagged crater of the patient's shoulder, violently packing the wound with a physical force that made the surgical residents gasp in horror. The patient's eyes rolled back beneath his fluttering lids. Even deep in the suffocating abyss of hypovolemic shock, his central nervous system registered the agonizing intrusion of Evelyn packing the wound. His body violently bucked against the gurney, the heavy steel frame rattling under a sudden, kinetic explosion of raw survival instinct. "Hold him! Pin his shoulders to the deck!" Evelyn barked. The 2 uninjured tactical operators instantly dropped their combined weight onto the man. They locked his torso in place with practiced, immovable force, treating him like a wounded brother on a tarmac rather than a civilian patient. Evelyn didn't pause. She shoved a second roll of hemostatic combat gauze deep into the supraclavicular cavity. Her fingers dug blindly past torn muscle fibers and shattered bone fragments, navigating by touch alone to find the source of the hemorrhage. The bright crimson welling up around her knuckles was a horrifying indicator of the sheer volume of blood the man was losing by the second. "It's not enough," the tallest surgical resident stammered, his eyes wide with terror behind his protective glasses. "He's still hemorrhaging through the packing. The pressure is dropping again. We need to clamp the artery." "You can't blindly clamp a junctional bleed in a soup bowl of blood. You'll sever the brachial plexus and permanently paralyze his arm, assuming he doesn't bleed out first," Evelyn snapped, not even looking up. She turned her fierce, unwavering gaze to the trembling triage nurse. "I need a Foley catheter, largest gauge you have on that cart, 24 French, and a 60cc syringe, flush with sterile saline. Move!" "A Foley catheter?" Dr. Vance Sterling screeched from behind the tactical wall, his voice cracking with hysterical disbelief. "That's for a bladder, you absolute psychopath. He needs a vascular surgeon and a bypass, not a janitor playing MacGyver." "Shut him up," Evelyn ordered the operator guarding Sterling. The operator smoothly unclipped his radio, took a half step back, and pressed his forearm heavily against Sterling, physically pinning the chief of trauma against a stainless steel supply cabinet. "Not another word, Doc, not one." Evelyn turned her attention back to the tall resident. "You, what's your name?" Miller," the young doctor choked out, his hands hovering uselessly above the patient. "Listen to me, Miller." Evelyn's voice dropped an octave, radiating a calm, terrifying intensity. "You are no longer a civilian resident. Right now, you are my cornsman. Put your hands exactly where mine are." Miller hesitated for a fraction of a second before plunging his gloved hands into the bloody cavity, his fingers brushing against Evelyn's bare, stained ones.
Lock your elbows. Apply downward, unyielding pressure on the gauze. If you let up for even a millimeter, he bleeds out on this table. Do you understand me?" "Yes, ma'am." Miller swallowed hard, pressing down with his entire upper body weight. The nurse sprinted back to the tray, tearing open the sterile packaging for the Foley catheter and the massive syringe with shaking hands. Evelyn snatched them up. She didn't have time to explain the physics of a makeshift balloon tamponade to a room full of panicked civilians. She just had to execute it. "Miller, on 3, pull your hands back exactly 2 inches. Give me a clear channel to the arterial bleeder. 1, 2, 3, shift." Miller pulled back. A fresh, terrifying geyser of arterial blood surged upward. Evelyn moved with blinding, mechanical speed. She threaded the unlubricated silicone tip of the Foley catheter directly into the deepest, most violently bleeding pocket of the wound tract. Once she felt the firm resistance of the arterial wall against the collarbone, she slammed the saline syringe onto the catheter's port. "Inflating," Evelyn announced, her thumb depressing the plunger with steady, immense force. 30 cubic centimeters of saline rushed into the tiny balloon at the tip of the catheter, expanding deep inside the patient's chest cavity. The balloon rapidly swelled, acting as a massive internal pressure plug that wedged itself aggressively against the severed subclavian artery, crushing the torn vessel shut. The instant geyser of blood stopped, reduced to a slow, manageable seep. "Clamp the line," Evelyn ordered. Miller, operating purely on adrenaline and Evelyn's gravitational pull, grabbed a pair of hemostats and clamped the Foley tube, locking the saline inside the balloon. A heavy, stunned silence descended on Trauma Bay 1. The only sound was the rapid but blessedly steady electronic beep of the heart monitor. "Pressure?" Evelyn asked, her voice barely a whisper, yet it commanded the entire room. The nurse stared at the monitor, tears welling up behind her mask. "It's 90/60. Heart rate is 110. He's stabilizing." A collective, shuddering breath left the lungs of everyone in the room. Evelyn slowly stepped back from the gurney. Her hands were stained crimson up to her wrists. The oversized blue scrubs of the hospital custodian were completely ruined. She looked at Miller, giving him a single curt nod. "Good work, Cornsman." Before Miller could respond, a heavy metallic clatter echoed near Evelyn's feet. In the frantic, violent chaos of her movements, the small zippered breast pocket of her scrub top had torn open. A solid black titanium card hit the blood-slicked linoleum. It wasn't a standard hospital badge. It bore a deeply engraved classified Department of Defense seal, a biometric microchip, and a single ominous string of letters and numbers. Sterling, finally squirming out from under the tactical operator's arm, looked down at the floor. His eyes widened as he processed the impossible object lying next to the custodian's faded sneakers. The heavy metallic clatter of the titanium card against the blood-slick linoleum echoed in the sudden, eerie quiet of Trauma Bay 1. Dr. Vance Sterling stared at the floor. His breath hitched. It wasn't a standard St. Jude's Medical Center ID. It was matte black, devoid of a name, photograph, or hospital logo. It bore only an engraved classified Department of Defense seal, a biometric microchip, and a single ominous barcode. Sterling pointed a trembling, manicured finger at it. What is that?" he stammered, his arrogance desperately trying to claw its way back through his shock. "Are you stealing hospital property? Security, I want her cart and bag searched immediately." Before the bewildered hospital security guard could even flinch, the tactical leader stepped forward. He didn't look at Sterling. He crouched down, his armored knee squelching in the pooling blood, and carefully picked up the black card. The operator's eyes scanned the heavy titanium rectangle. He recognized the metallic sheen and the distinct lack of identifying information. It was a Joint Special Operations Command access card, Level 0. The kind of clearance that didn't just open doors, it commanded federal airspace. He looked up at Evelyn, his expression shifting from battlefield urgency to profound, stunned reverence. Evelyn ignored both the card and the operator. Her hands, still stained dark crimson, were systematically checking the patient's vitals. The heart monitor beeped a steady, reassuring rhythm. The improvised Foley catheter balloon was holding the massive subclavian hemorrhage at bay. "Miller," Evelyn said, her voice snapping the tall resident back to attention. "He's stabilized for transport, but the balloon tamponade is temporary. You have a maximum of 45 minutes before tissue necrosis begins at the clamping site. When you get him up to the OR, you do not pull that catheter until the vascular team has a synthetic graft ready to go. You understand?" "Yes, ma'am," Miller replied automatically. He wasn't looking at Dr. Sterling anymore. He was looking at the woman in the ruined blue scrubs as if she were a deity who had just descended from the fluorescent lights. "Wait a minute," Sterling finally exploded, stepping out from behind the tactical wall, his face flushed with renewed, frantic outrage. "You do not give orders in my ER. You are a janitor. You performed an invasive, wildly unauthorized procedure. You could have killed him." "I saved him," Evelyn replied flatly, grabbing a clean surgical towel and wiping the worst of the gore from her hands. "Now get him to surgery." "You're not going anywhere," Sterling snarled. He turned to the two city police officers who had just rushed through the shattered ER doors, their hands resting nervously on their duty belts as they took in the carnage. "Officers, arrest this woman. I want her charged with aggravated assault and practicing medicine without a license. Cuff her right now." The officers looked at the chaotic scene, the armed tactical team, the bleeding VIP, the sputtering chief of trauma, and the unassuming middle-aged custodian covered in blood. One officer unclipped his handcuffs and took a hesitant step towards Evelyn. "Ma'am, I'm going to need you to turn around and put your hands behind your back," the officer said, his voice tight with confusion. Evelyn didn't move. She didn't raise her hands. She just looked at the officer with tired, unblinking eyes that had seen the fall of entire cities. Before the officer could close the distance, the tactical leader's encrypted shoulder radio erupted with a burst of deafening static. The channel was on an open external speaker, and the voice that cut through the ER wasn't a local dispatcher. It was crisp, authoritative, and laced with high-altitude military interference. "Echo Team, this is actual Overwatch. Be advised we have your location. Secure the perimeter. The package is inbound. ETA 2 minutes. We are tracking a localized distress beacon." The tactical leader's head snapped up. He looked at the black titanium card in his hand, then at Evelyn. "Ma'am, is this your beacon?" Evelyn finally sighed, the immense adrenaline slowly draining from her shoulders. "It has an active RFID failsafe. It triggers if my heart rate spikes into a combat zone or if it's separated from my biometric proximity. They're here." "Who is here?" Sterling shrieked, his voice reaching a hysterical pitch. "I am the chief of trauma. I demand to know what is going on in my hospital." The answer came not from Evelyn, but from the violent shift in air pressure outside. The wailing sirens of local police cruisers were suddenly drowned out by a terrifying, heavy, rhythmic thrumming that rattled the very glass of the hospital windows. It was the distinct, unmistakable, chest-rattling roar of twin-engine military Black Hawk helicopters descending directly onto the hospital's front lawn. The hurricane-force downwash from the twin MH-60M Blackhawks sent loose medical charts and debris violently swirling through the shattered glass doors of the ER. The deafening roar of the rotors vibrating against the hospital's foundation was a terrifying display of absolute, unyielding power. Dr. Vance Sterling covered his face, staggering backward as a dozen men in sterile black tactical gear poured into the trauma center. They didn't run, they flowed. They moved with a silent, terrifying synchronicity, their assault rifles lowered but ready, instantly establishing a hardened perimeter around Trauma Bay 1. The two city police officers, realizing they were completely outgunned by federal Tier 1 operators, slowly took their hands off their duty belts and stepped back against the wall. "What is the meaning of this?" Sterling screamed over the dying whine of the helicopter engines, his face a mask of panicked indignation. He pointed a shaking finger at Evelyn, who stood quietly amidst the chaos, her blood-soaked hands resting by her sides. "I am the chief of trauma. This woman is a dangerous psychotic. She assaulted my staff and mutilated that man. Arrest her." The tactical operators ignored him completely. They didn't even acknowledge his existence. From the center of the tactical formation, a tall, imposing man with steel-gray hair and the unmistakable 3 silver stars of a lieutenant general pinned to his collar stepped forward. He wore a crisp, tailored dress uniform that contrasted sharply with the battle-worn gear of his men. His eyes, cold and analytical, swept over the chaotic scene. He took in the injured VIP, the panicked civilian doctors, the terrified police, and finally the flawless, impossible Foley catheter balloon tamponade keeping the dying man alive. The tactical leader who had guarded the patient stepped up to the general, wordlessly handing him the matte black titanium ID card. The general glanced at the classified seal, a muscle feathering in his jaw. He looked up, his gaze bypassing the sputtering chief of trauma entirely, and locked eyes with the middle-aged custodian in the ruined, oversized blue scrubs. Sterling, desperate to regain control, stepped directly into the general's path. "Listen to me. I demand you secure that woman. She is a janitor who just practiced medicine without a license." The general stopped. He slowly turned his head to look at Sterling, his expression radiating absolute, withering disdain. "Doctor," the general said, his voice a quiet, terrifying rumble that carried across the silent ER, "step aside." Sterling opened his mouth to argue, but two operators instantly stepped forward, physically shifting him out of the way like a misplaced piece of furniture. The general walked straight up to Evelyn. He stopped 2 paces away, his heels clicking together sharply on the bloody linoleum. Slowly, deliberately, the 3-star general raised his hand in a crisp, razor-sharp salute. Instantly, every single heavily armed operator in the room snapped to attention, their salutes mirroring the general's. The sound of a dozen combat boots locking together echoed like a gunshot. The ER staff gasped. The police officers stared in open-mouthed shock. Sterling's face drained of all remaining color, his mouth hanging slack. "It's been 3 years, Archangel Actual," the general said, his voice laced with profound respect. "We thought you were a ghost." Evelyn didn't salute back. She just let out a long, exhausted sigh, the weight of her past settling back onto her shoulders. "I was enjoying the quiet, General. The floors here were very peaceful." "Archangel?" Sterling choked out, the reality of his humiliation finally penetrating his arrogance. "She's a floor cleaner?" The general turned his icy gaze back to the shattered chief of trauma. "The woman you are pointing at, Doctor, is Major Evelyn Hayes. She is a 2-time recipient of the Distinguished Service Cross and the former lead surgical asset for JSOC's elite forward operating extraction teams. She has performed blackout combat surgeries under heavy artillery fire that you couldn't comprehend in your brightest operating room. She has pulled more of my people out of the grave than you have had hot dinners." The general gestured to the stabilized VIP on the gurney. 2 elite military flight medics rushed past them, seamlessly taking control of the gurney from the stunned surgical residents. One of the medics looked at the clamped Foley catheter, his eyes widening behind his visor. He looked up at Evelyn in awe. "Textbook Archangel protocol, ma'am. Beautiful work. We have the con." "Keep that clamp steady until the vascular team has a graft ready," Evelyn instructed softly, her tone shifting back to the quiet, unassuming woman they all thought they knew. "He's got a fighting chance." "Yes, ma'am," the medic replied enthusiastically, pushing the gurney toward the awaiting helicopters. Evelyn looked down at her faded, blood-stained sneakers, then over to the mop she had dropped just 20 minutes ago. The peaceful rhythm of push, sweep, ring, repeat was gone forever. Her cover was blown. The world she ran from had found her again. She looked at Dr. Sterling, who was leaning against the supply cabinet, completely speechless, his career and ego thoroughly dismantled in front of his entire department. She didn't gloat. She didn't need to. "Dr. Sterling," Evelyn said calmly, untying the blood-soaked scrub top and letting it drop to the floor, revealing a plain black t-shirt underneath. "I think I quit." Without another word, the legend known as Archangel Actual turned and walked out through the shattered glass doors, flanked by a phalanx of Tier 1 operators, leaving the arrogant experts of St. Jude's Medical Center standing in stunned, absolute silence.